I think that a lot of organizations struggle with data, and I think the timeliness, as you just mentioned in your response, that we see so much data accumulated throughout, all the different systems and the stay and all that kind of, but the ability to quickly turn that back into insights uh, while the patient is still in the hospital, so that interventions can then, and kind of knowing what interventions can be put in place to try to affect things in a near real time fashion. I think, given that was a previous chapter in your career, it's something many organizations still struggle with, right? What were some of the metrics that you were tracking with the team or looking at to try to improve the overall operations there?
Yeah, and I will. It's a great question, and I would answer that and have by this. I still have a really strong passion for length of stay. And during my time at Allina, I was asked to take on responsibility for inpatient coordination across the system, really with a specific charge to improve length of stay. And through a lot of work, a lot of great collaboration, we ended up landing on it fundamentally as a deliberately simple method. Um, as I think many people listening to this know, every year CMS reports out on for every MSDRG um, that they have, the geometric mean length of stay associated with every one of those MSDRGs. And using some early data analysis, what we're able to do is to create a model where we compared actual versus expected. And what we used for expected was the geometric mean length of stay. And I want to be clear that expected didn't necessarily mean we expected every patient to be at it. We just used that as really kind of a line in the sand. And we ended up expressing that number as a percentage. And what it did is it offered a rough acuity adjustment that everyone could pretty easily understand and that everyone could pretty easily follow. And critically, it allowed us to be able to compare facilities, to compare um, physician groups, to compare um, just across the board. And that was what was so powerful.